Well, thank you so much, everyone, for joining us. This is day 2 of our Medicare, Medi-Cal, and Covered California training for Santa Clara CoC. Quick intro for those of you that don't know me. My name is Carla, and I work for Homebase. And Homebase is a nonprofit technical assistance provider. We provide technical assistance for COCs and communities across the nation. But one of our roles with Santa Clara County's Office of Supportive Housing is coordinating trainings such as these, such as this one, for you all homeless service providers to hopefully better serve your clients and just support you in your work. So we're constantly looking to improve our training. So towards the end, I will be popping in a feedback form specific to this training. And we'll also be sending that feedback form later in a follow-up email. It really helps us to get your feedback. So please take a couple minutes to fill it out, especially when it's all kind of fresh in your head. And just as a reminder for folks, maybe you haven't ever been to one of these trainings before, so this is new to you, but the PowerPoint presentation and the recording of the training will all be publicly available. It'll all be posted on the CoC's training website, and when it is available there, we will send out an announcement to the SPN and CoC listservs. So you should be informed when that happens. So like I said, today's part 2 of this training. We are also going to have a custodial trauma training in late September. The exact dates are almost finalized, but still being worked on. And then we also have an additional navigating mainstream benefits trainings on WIC, general assistance, SSI, and SSDI, and those will also take place in the fall. So as always, I know everyone's really familiar with Zoom by now, but just some housekeeping things. The live transcript function is available if that's something that you would like to have. We are going to utilize the chat box for your questions and for comments throughout the training. So what we're going to do, which worked really well during part 1 of this training, is I know it's a lot of material. So as you think of questions, feel free to pop them into the chat if that's accessible to you. And then at the end of the training, when we get to the Q&A, I will call out the questions in the order that we received them in the chat. And then if you have any tech issues, feel free to either message me directly on here, or you can email me at carla@homebaseccc.org, and I will be checking my email throughout the training. So if you need a troubleshoot, I can try to help you out there. So I know I just talked really fast, but those are kind of the basics. Now I'm going to actually pass it really quickly to my colleague, Riley, who is going to just make a quick announcement that's very timely and related to the subject matter of this training today. So Riley.
Thanks so much, Carla. Yeah. Hi, everyone. I'm Riley Meave here from Homebase, and I just have a quick announcement about Medi-Cal renewals and specifically their unique impact on people experiencing homelessness. As of July 2023, the requirement for Medi-Cal members to renew annually has restarted. Millions of members in the state are unaware of the renewal process and therefore are going to risk losing coverage because they won't renew or they won't know how to renew. Although some individuals will be renewed automatically, most members are going to receive renewal notices in their renewal form in the mail. That's an obvious barrier to people experiencing homelessness who probably don't have a current mailing address, or their mailing address has changed multiple times in the past 3 years. It is critical that stakeholders in the homeless response system are aware of this emergency, as well as the solutions for keeping unhoused populations enrolled in Medi-Cal. One solution we have on here is to offer up your mailing address to clients so they can receive their Medi-Cal notices on paper, but it's not the only strategy. The Department of Healthcare Services has already released great flyers and resources that explain how to renew, and Homebase is also soon to be launching our own toolkit that is more specific to the unique challenges facing people experiencing homelessness that are also Medi-Cal members. Homebase is hosting a statewide webinar to discuss all these topics on October 3rd. This is just kind of a teaser to the information. We want you to be thinking about it before then. And anyone is welcome to attend this webinar, but it'll be particularly useful to homeless service providers. And I think Carla put in the link to the registration for the webinar on October 3rd, as well as some other helpful resources. That's all I have to say for now, so I'll pass it back to Carla, but I know Bay Area Legal Aid here today is going to provide a little bit more context about Medi-Cal renewals. Thank you.
Thanks so much, Riley. And I see that we've got some questions in the chat. Rhonda or anyone else that might have questions, go ahead and pop your questions in the chat, and then I will track them and connect with you offline about this specifically with the home-based team that's working on this. All right, so just a quick little icebreaker for folks to start using the chat. For those of you that haven't already, please type in your name, your organization, and something you're proud of this week. And in the meantime, I'm going to go ahead and stop sharing my screen for a second as I pull up our presentation, and then I will pass it to Emma and Angelica to begin our training.
Thank you so much. It's so great to meet you guys. For those of you who were not with us last week, and for those of you who were with us last week, it's so nice to see you again. My name is Emma Dinkelspiel. My partner here is Angelica Galang, and we are here from Bay Area Legal Aid Health Consumer Center to give the second half of this presentation, focusing, again, we're going to cover more of Medi-Cal and also covered California. We'll pick up with part two. I'm going to hand it over to Angelica.
All right. Thank you, Emma. Sorry, I was having an issue with my sound. As Emma said, my name is Angelica Galang. I'm an attorney at Bay Area Legal Aid Health Consumer Center. So I know we had a lot of information last week. Today, we're going to shift over along to the Covered California piece of the Affordable Care Act continuum. Next slide, please.
Give me just a second because it seems like it froze.
I guess I'll take this opportunity to answer Brenda's question while we're troubleshooting. Rhonda, I'm so sorry, Rhonda's question, which is, will there be any revision to the Medi-Cal renewal packets that get sent out? These are very unorganized. The page numbers don't make sense. I helped the client with one side of the page said page 7 of 25. Well, the back side would say something like page 5 of 9. The packets are very confusing. The Department of Healthcare Services, to my understanding, would like to hear all of this feedback, and please do reach out to them. That said, I would be very surprised to hear that changes were made to the renewal packet right now. Usually renewal packets are usually that process is a link. Changes that are made to renewal packets take a long time. If we're looking at printing errors where with page numbering errors of the kind that you're referring, that sounds like a printing mistake of some kind, and I think both Santa Clara County and the department would like to hear about it. The packets, as they are meant to be sent out, don't contain mistakes of that kind, which doesn't mean that they aren't confusing. They certainly are, they're it's always a good idea to make sure that the department and the county are aware of things that are obstacles for your clients to use these services, but these changes take a really long time to make. So definitely submit them, and then hopefully by next year we can in the next round of revisions we can see something a little bit better. And Riley has put an email in the chat box. Oh yes, okay, good, Rhonda, you've seen that, which is meta-cal@homebasecc.org. Homebase can help share this information with the Department of Home Care, Healthcare Services, which is great.
Thanks, Emma. Okay. Does it, Carla, I think we are, looks like we're all good. Hopefully, hopefully you're seeing that on your end too. Again, today's focus, well, one of the main subjects today, and the one that I'll be spending most of my time on, is Covered California. You know, the nuts and bolts of it, and as well as some information on coverage options for undocumented individuals. Next slide, please. And I actually think I might, just to reiterate, we are the Health Consumer Center. We are a legal advice hotline that provides, thank you, that provides free assistance on health coverage, health access to healthcare issues. In some cases, we provide extended representation. You know, that can be a brief service call to a third party, you know, all the way up to a representation at a state for a hearing. We serve folks who are non-native English speakers all the time. We have access to a telephone interpreter services. Language should not be a barrier to healthcare, and it certainly is not a barrier, or should not be a barrier to our services. And we also serve seven Bay Area counties. We're a pretty small team, but we you know, can get all over the Bay Area. For the most part, if you are calling from San Mateo County, if you live in San Mateo County, we would refer you to our subcontractor, which is the Legal Aid Society of San Mateo County. They are also called the Health Consumer Center. They provide the same services, just, you know, it's just the way that the grants are written up. And then, you know, unlike a lot of other legal nonprofits, we are not limited to income level. Income level is not a criteria for our services. You can be, you know, making a ton of money or no money at all, and still qualify for legal advice, assuming you meet the other eligibility criteria that we would review at the time of the call. Next slide, please. And one more. Okay, finally, we're getting into the topic of my portion of today's piece, which again is Covered California. So on this slide, you'll see the Affordable Care Act coverage continuum. And we talked about this, we talked about the first part of the continuum, 0 to 138% of the federal poverty level last week. That if you are of age and income eligible, as in you are 138% or below of the federal poverty level, you would be in the Medi-Cal portion of this continuum. And you know, these are numbers that are set by the IRS. They do not take into account cost of living in the Bay Area. So 138% of the federal poverty level is very low, especially where we live. So if you are above 138%, you would not qualify for Medi-Cal. You would be in the Covered California portion of the continuum. So you up to 138%, that's Medi-Cal for adults. Up to 266% of the federal poverty level, that's where you know, children can qualify for Medi-Cal. They can get a higher income. They can have a higher income and still qualify. And then you can qualify, and then those above 138% up to 600% of the federal poverty level would qualify for Covered California tax credits. And so, you know, Covered California does not have an income ceiling. You can make $1 million a year and still be able to purchase a plan on the marketplace. You would just not be eligible for premium tax credits. Premium tax credits are subsidies from the government to offset the cost of the premium for your plan. Consumers who are at 400% of the federal poverty level or higher, may receive or lower, may receive a premium tax credit to lower their premium to a maximum of 8.5% of their income based on the second lowest silver plan cost, silver plan in their area. So I know that's a lot of information. Let's go over, what that means. Next slide, please. Okay, so just a quick overview of where we're going. Covered California is California's health insurance exchange. In 2023, if you qualify for financial assistance, meaning if you're at 400% or below the federal poverty level, you can get assistance for help with your monthly premiums so that your household wouldn't pay more than 8.5% of the income. And if you are under 250% of the federal poverty level, in addition to your premium tax credits, you can also get cost sharing reductions. That basically means that you, in addition to assistance with your premium, financial assistance with your premium, you would also get extra savings for co-pays, deductible, and other medical services. There are 4 metal tiers for each of the qualified health plans: bronze, silver, gold, and platinum. And then each plan tier level has a different actuarial value, which we'll go over on the next slide, please. So actuarial value is the percentage of expected healthcare costs that a specified health plan will cover. So if you have if you choose the bronze plan, a bronze plan would cover about 60% of healthcare costs. It's generally this value is generally calculated using the ratio of the total expected payments by the plan for essential health benefits. And the Affordable Care Act identifies specific actuarial value categories as metal levels. Again, there's your bronze, silver, gold, and platinum. Silver 94, 87, and 73, you would pay a lower deductible, copay, and out-of-pocket max. Bronze plans, which we generally they may be appealing early on. You of course have a lower premium, but they would have, say you needed a covered service, or they have the least generous cost coverage, whereas platinum plans, much higher premium, but then if you are in need of an MRI scan or any other covered service, more of that would be covered by the plan because you had paid more in the deductible upfront. And next slide, please. Okay, so let's talk about advanced premium tax credits, or what I'll refer to as APTCs. Your eligibility for APTCs would reduce the amount of the monthly premium. These premium tax credits are paid directly by the federal government to the health plan, and then the consumer or the member, the plan holder, would pay the remaining balance to the health plan. One's eligibility for APTCs does depend on the annual income. So when you're applying for Covered California during open enrollment or a special enrollment period, we'll get to that later, you would estimate your annual income, and you do have to estimate your annual income. But when you sign up for a Covered California plan, you also agree to update your income if it changes with Covered California within 30 days. So you estimate your annual income. Say you are at 350% of the federal poverty level. You're certainly over 138 for Medi-Cal, but you are still under that 400%. You would receive a notice, an eligibility determination, with the amount of APTCs that you are eligible for, and then the amount that the consumer or that your client is responsible for paying. When you sign up for a Covered California plan, or when you enroll, you do agree to, another thing you agree to is filing taxes every year. There is what's called reconciliation or recon at the end of every year, at the beginning of every tax season, where if you don't accurately report your income, you can owe back that APTCs that you may have received, or that the IRS that the federal government may have paid to the plan on your behalf. For example, if you pay, say you're at 350% of the federal poverty level for 7 months of the year, and then you get laid off, so your income drops. Your income is much lower, but you're still, for whatever reason, paying the same. But you forget to report it, and you're still paying that same premium as when you were working your job. You file out taxes at the end of the year, and then it would show that you are actually owed back the tax refund based on the premium that you may have overpaid throughout the year. If you start the year off making very low income, and then you get this new nice fancy job and you earn more income than you initially predicted, but then you didn't update your income, and the federal government still pays the same amount of premium as if you were maybe not having making as much income, then you may have to owe back or repay the IRS all of the a portion of the premium tax credits that were overpaid on your behalf to your plan. It's a big problem. We get a lot of calls about this during the tax season. Like, I didn't know I had this Covered California plan. I never called to cancel it. Whether you did or not, those APTCs were paid on your behalf and are owed, and you would then owe back. So it's important for your clients to know that they do have a lot of responsibility. We hear a lot like, "Oh, I didn't know." It's super, it is your health coverage. It's just super important to reiterate that you need to be on top of it, just so that you're not forced with this huge repayment that you owe back, or reconciliation that you owe back when come tax season. Next slide, please. Okay. And what are in addition to advanced premium tax credits, that's the most the most common type of financial assistance that you can receive if you have Covered California, if you are eligible for APTCs at least. You'll also find out when you apply whether your income qualifies you for extra savings, known as cost sharing reductions. If you are under 250%, or if you're at 250% and below the federal poverty level, and you select a silver plan, you can save money a second way, and that is by paying less out of pocket each time you get medical services. So you do have to be under that income level to be eligible for these extra savings. But in addition to assistance with the premium, you would also get assistance with out-of-pocket costs, medical services, deductibles, co-insurance, and any co-pays. So in this case, the government would again pay directly to the health plan, and it would reduce various out-of-pocket costs. Next year, if you qualify for CSR or cost sharing reductions, your deductibles would actually be set to zero. So big year for a number of reasons, for, I would say, healthcare or health law. And then there is no end of year reconciliation if you qualify for cost sharing reductions. Next slide, please. So who is eligible for Covered California? Even though you don't qualify for premium tax credits or cost sharing reductions, CSRs, you can still enroll in a plan. Like I said earlier, you can make up to, you can make $1 million and still be able to eligible to purchase a plan from the exchange. You just wouldn't get the premium tax credits. As if you are if you have an income between 139% and 600% of the federal poverty level through 2025 at least, you would be eligible. Or if you are between 100 and 138% of the federal poverty level, but not eligible for Medi-Cal for some reason, say you don't meet the immigration status, you can still be eligible for Covered California. You do have to have a qualifying immigration status for covered California. You must be lawfully present with a tax ID number, either a social security number or a TIN, tax ID number. Prucol residents are not eligible, and unfortunately, DACA status holders are also not eligible for covered California. They may still be eligible for emergency services through Medi-Cal. I'll touch on that later, but not covered California and perhaps not full scope Medi-Cal benefits. You also must not be eligible for other minimum essential coverage. So if you are eligible for affordable employer coverage, you wouldn't qualify for covered California, as well as those with Medicare cannot enroll in a covered California plan. We get this question a lot. Maybe a third category is if people are income eligible for Medi-Cal, but for whatever reason they don't want Medi-Cal. They say, oh, I had a bad experience with Medi-Cal. I was unaware of how Medi-Cal has greatly expanded or since the Affordable Care Act. So I just don't want the Medi-Cal. I want covered California. You can do that, but you wouldn't be eligible for advanced premium tax credits. And since that person is presumably already on the lower income end of things because they are income eligible for Medi-Cal, premium tax, no APTCs would be an extremely high premium. Maybe 800,000. It really depends on your household. We always encourage everyone, if you're income eligible for Medi-Cal, that it would be in your best financial interest and interest just to get access to care now to accept the Medi-Cal plan. Otherwise, you'd have to go unsubsidized with covered California. Next slide, please. All right. Oh, thank you. Okay, so let's talk a little bit about modified adjusted gross income insurance households, or MAGI. Excuse me. Whether someone qualifies for APTCs and CSRs also depend on the MAGI, or modified adjusted gross income household size, and the income of that household. So how does covered California eligibility count household size? It's based on tax relationships. So whoever is in your MAGI household, as it is whoever you file taxes with, is your MAGI household. So if you are the tax filer and you have 2 dependents, you count as a household of 3, and the sum of the 3 modified adjusted gross incomes of all 3 people, that is your household income. If it's just a married couple, so 2 partners, they file taxes together, their MAGI is 2, their household size is 2. And that another requirement is that if you are married, you do have to file taxes jointly. So you may think like, oh, I'm at 350% of the federal poverty level with my own income. I should certainly qualify for APTCs. Just make sure that you have to have the understanding or explain to your clients that the income of both partners in the household, if they're married, is counted as part of the household income, total household income. There are a lot of exceptions. So the household, just to note here, we won't get into a ton of those right now, but household size and income can just be tricky to calculate. For example, one example is, just two people in the same household can be eligible for different programs, right? Like if you're not married, but you're living, or so you're not married, but you're in the same MAGI, you claim your child is your dependent. What you could be on covered California, but your child could be on Medi-Cal. So even if you live in the same household, you could still have different Medi-Cal programs, or excuse me, health insurance programs. Next slide, please. Okay, so when can you enroll in Covered California? Open enrollment for Covered California is November 1st through January 31st. You'll start seeing commercials, hearing it on the radio. Your clients will start getting renewal notices in September, October. Don't ignore those. Sometimes these renewal notices say that, hey, if you don't tell us you don't want this plan, your plan is going to renew automatically. We get calls like that all the time, and then people have that tax issue at the end of the year. So definitely encourage your clients to be paying close attention to the notices. Don't just throw them away around the fall time, and especially around the fall time. You do have to enroll in a plan by December 15th to get coverage starting January 1st. If you enroll in a plan on December 16th through the 31st, your coverage wouldn't start until January 15th. And that's for every month. If you, for example, if you have a special enrollment period, which we'll talk about now, I guess, outside of open enrollment, sometimes people can enroll in coverage outside of the OEP, the open enrollment period. This is called a special enrollment period. Special enrollment periods people are eligible for special enrollment periods if they have a qualifying event. That can be a loss of a job, you got married, you get divorced, you have a child, you lose your affordable health coverage, say you get laid off, you don't have, your employer doesn't continue coverage, your coverage is going to end August 31st. Obviously that's not during open enrollment, but because you have just lost your employer coverage, you would then qualify for an SEP, special enrollment period. There are more SEPs than are on these slides. And the list is included on Covered California's website. I think every time I found it, I just literally Google Covered California special enrollment periods. It'll give you the list of qualifying events that may allow your clients to enroll in Covered California that is outside of November 1st through January 31st. And one thing I might have missed from earlier is that California did restore the individual mandate effective 2020. So you do have to have health coverage or pay a penalty come tax season, unless for some reason you are exempt. Next slide, please. Okay, so let's talk about kind of the roadmap you want to follow, general roadmap you want to follow when you're trying to figure out if someone is eligible for Covered California. So the first question is, can this person purchase a plan on the marketplace on coveredca.com? Do they qualify? Do they have a qualifying immigration status? Do they fit the immigration requirements? Is it open enrollment period? If it's not open enrollment period, did they just lose their job and they're going to lose their health coverage at the end of the month? So qualifying them for a special enrollment period. And then the second question you want to ask is, or the second category is whether the person qualifies for financial assistance to help lower the cost of their premium. To qualify for financial assistance, you do have to be income eligible. You do have to agree to certain tax filing requirements. That means you'd agree to file taxes in the year that you receive the subsidy. You agree to file taxes jointly with your spouse if you're married, and you are agreeing to pay back any subsidies you receive if you end up being over income for those premium tax credits at the end of the year when you file your income, or when you file your taxes. Next slide. So can this person, are they eligible? Are they immigrant? Are they eligible? Do they meet? Is it open enrollment? Do they have a qualifying immigration status? If it's not open enrollment, is it a special enrollment period? And then do they qualify financially to lower their costs? Um, Next slide, please. I was a little behind you. Well, I have one example here. So Sean has just been laid off from their job. Their employer-sponsored health coverage will terminate at the end of this month on August 31st. What are some questions that we should be asking to help determine the health insurance options that are available to Sean? Next slide, please. So the first question is how old is Sean? What income tests are we using? If Sean is 65, do they qualify for Medicare? And because if they do, they would not then be eligible for Covered California. Does Sean have any other health insurance? So, is Sean going to be at zero income next month? He would then be eligible for Medi-Cal rather than APTCs through Covered California. Does Sean have, say Sean has a part-time job lined up, but they don't get health insurance through this job, that still is reportable income. So, if it's under 138, then maybe they'd be over with Medi-Cal. If it's above, then we can talk about Covered California eligibility. What is Sean's income in the month of August? And then is that going to change? Does Sean have a plan to find a job? If he reports zero income in August, but gets a job, in November and never updates his income and gets those premium tax credits paid from the government to his plan every year, that could cause an issue come tax season. I keep pushing that because we just see it so much, and it's a big bummer. Then taxes are terrible enough, and then of course have this on top. And then does Sean have any disabilities? For example, do they meet the disability Social Security definition of disability, but can still work? Would they be then eligible for the 250% working disabled Medi-Cal program that Emma discussed last week, for example? So these are this is the main core of what people should understand about Covered California. There's actually, I will say that the website is not terrible, coveredca.com. Google should be a great friend. Special, like I said, I Google all the time, Covered California special enrollment periods. I just forget there are a lot of them. So if you're outside, if you're not sure, definitely check out the information on their website. Next slide, please. I'll do one, like I said, it was mostly Covered California and then a little bit on undocumented health insurance, mostly because there aren't a lot of options, unfortunately, but we'll talk about here. So if you are undocumented, you cannot purchase a Covered California plan. You could purchase a private health plan at full cost, or excuse me, I'm sorry. If you aren't allowed to purchase Covered California, you would not be eligible for APTCs or CSRs. You would be exempt from the individual mandate, so you wouldn't get a tax penalty for not having this coverage. You also wouldn't qualify for Medicare. Under federal law, you are still eligible for emergency care. But here's some good news. If you are low income and you are eligible for full scope free Medi-Cal if you are under 26 or over 50. So under 26 and over 50, even if you are undocumented, you get full scope free Medi-Cal. And next year, everyone, even between 26 and 49 years old, if you're undocumented, you are still eligible for free full scope Medi-Cal. Right now, if you're between 20 until the end of the year, if you're between 26 and 49, you are only eligible for emergency or restricted Medi-Cal, not full scope. You can seek if you are undocumented, you can seek non-emergency health services at community health centers or at safety net hospitals. And then, you know, if you do get care from hospitals and you do get a big bill, you should really consider applying for financial assistance, or at least finding out if you're eligible. The law is that 400% of the federal poverty level and below, you are eligible for financial assistance for hospital bills. This doesn't necessarily extend to, you know, in-person provider medical clinics. But if your client does get a big bill, please do have them call us or call with them if you have the capacity, because we advise on charity care all the time. We do have qualifying immigration statuses for our services, but we can at least point you in the right direction to the charity care application for the particular hospital that your clients may have received services from. And I think that's it for me. I'll turn it over to Emma to talk about state for hearings and appeals.
Yes, thank you so much. Hi, I am Emma, and I'm going to get started with a few other bits and bolts, and then we're going to do sort of a refresher, talking about some of the things we talked about last week and some of the things we've talked about this week, and putting it in sort of a real world context. So let's start with state fair hearings and appeals. So next slide, please. The state fair hearing process is a right that recipients of a state or federally funded public benefit that which is what we refer to as an entitlement benefit, meaning if they meet these criteria, they get the benefit. People who fall into those criteria, benefits that fall into those criteria, beneficiaries have the right to a state fair hearing, usually, and in this case, exclusively through the California Department of Social Services. The state fair hearing process applies to any action, or in many cases inaction, of a state agency or a county or a Medi-Cal plan, or in some cases a Medi-Cal provider, which or in some few cases also a covered California or an exchange plan. All of these can have appealable actions or inactions, which you can challenge the state fair hearing process. This includes your application wasn't decided on time, or your application was denied. That one's kind of more obvious, but it also includes, I was switched from Santa Clara Family Health Plan to Anthem without my consent. That it can include, I was assessed for an advanced premium tax credit that I think is too low. I think I should be getting more help from the government. It can include my Medi-Cal share of cost seems too high. The math doesn't seem to work out. And it can also include, I called my Medi-Cal plan and they said I can't be referred to acupuncture, or they said I can't be referred to an oncologist. These denials of healthcare services through Medi-Cal can be appealable actions, as can network adequacy problems. There aren't enough appointments available with an oncologist. They said it's medically necessary. They agreed with me on that, but they couldn't get me a slot. That might be something that you have the right to appeal. And then finally, there's a grab bag of issues that people are very surprised to find out the state fair hearings process applies to, but totally does. My county won't issue me a benefits identification card with my name on it, or with the right gender marker on it. I call the county and they say there's no interpreters available and I have to proceed in English. An action or an inaction by the county or the state, by an official agent that affects your rights or your ability to access a benefit that you should be getting, these tend to be appealable. Like I said, we're focusing on the California Department of Social Services state fair hearing process. I just want to put a quick plug in for a different process, which is your right to appeal decisions of a managed care plan to the Department of Managed Healthcare. This applies to all covered California plans and many Medi-Cal plans. These are decisions of the plan itself to fail to decide to decide not to cover a service, or to deny a bill, or to charge you too much money, this kind of thing. Those decisions made by the insurance company, by Alameda Alliance, or by Anthem, or by what have you, these are decisions that can be appealed to the Department of Managed Healthcare in many cases, and in many cases should, including decisions that something is or is not medically necessary. But we're not focusing on that today. We're focusing on the parallel right that applies to all Medi-Cal plans and to decisions about eligibility for Covered California, which is the state fair hearing process. Next slide. So how do you request a state fair hearing? Anytime you get the adverse, as soon as you find out about the adverse action, a clock starts ticking. Usually that's 90 days. That would be 90 days from the notice of action, or if you don't get a notice of action, it might be 90 days from the date that you find out about the piece of information. Legally, you have there is no hard limit. If you never receive a language compliant notice of action, there is no the clock has never started, but it's always better to get it in sooner rather than later. So that 90-day rule of thumb can be really helpful to use, even if you haven't gotten something in the mail. And you do have the right to a language compliant notice of action. If you have notified the county that you speak only Spanish, the county sends you a letter in English saying you don't qualify for Covered California. That is not a notice of action. So even if you got that notice, that letter in a language that they know you don't speak, a year ago, you may still have the right to appeal. That applies to people who speak threshold languages, and meaning languages that are sufficiently common within the counties that the county will have these documents translated. But generally speaking, you always have the right to use an interpreter. You always have the right to communicate, to know exactly what your rights are when you're speaking with the county. So you have 120 days for a denial for a healthcare service. So this is what I was referring to before. You call your plan. The plan says, "I'm sorry, we don't agree with your doctor. You don't have the right to see a therapist," or "We don't cover that." Or they might say, "We are." In the Medi-Cal context, again, we're referring to in the Medi-Cal context, you go to your plan, they say, we're not going to cover therapy, that's just too expensive for us. Or they say, we just don't have any appointments for therapy, call us back in 6 months. That's a denial of a covered healthcare service, and you have the right to appeal that. And you have 120 days to appeal it through the state fair hearing process. It's from the date of denial. There have been extensions on both those dates during the pandemic public health emergency. Now that has come to an end. But there probably are a few lingering issues to whom these longer deadlines apply. So we still have them on the slides. It's 210 days from the notice of action for issues that arose during the active public health emergency, and 240 days for denials of healthcare services that arose during the public health emergency. As long as you put in the appeal before the action goes into effect, so you get a Medi-Cal termination, that termination date is effective September 1st. You file the appeal today. You should continue to receive Medi-Cal until after the hearing. You do want to affirmatively request aid paid pending just because mistakes do get made, but generally, but the rule is if you put in the request in advance, it should be processed automatically. There is also a small window. I don't want to be I don't want to get it wrong on a recorded training. There's a few day window that you have after the notice of action goes out. Even if the notice of action doesn't get to you in time, such that you could appeal before the decision is made. So let's say you lose your IHSS, you get the notice doesn't come to you in the mail, there's a delay in the mail, it doesn't come to you till the end of the month, and it takes you a couple of days to talk to a lawyer, and the date on the notice of action is, I'm making this up, August 29th. And September 2nd is when you put in the appeal. Because it's in that really short little window, you still might be able to get aid paid pending. Again, make sure that you affirmatively request it. It's just safer. Next slide, please. State fair hearings do sound intimidating. They really aren't. They're a fairly informal process. They are, at this point, almost entirely phone calls. You do have the right to request alternate modalities. So you have a client who doesn't have a phone, or who really feels that they need to be heard in person, that is an option. Sometimes for Medi-Cal hearings, that might mean in certain circumstances going up to Sacramento, so it's not always more beneficial. But you do have we've been a big fan of the phone version of the state fair hearing process, but it's not always the best for everyone, and you do have the right to be heard in person if that's what you want. can also request Zoom hearings, and I'm not sure what the criteria are that they use to decide on whether those will be granted, just because I haven't had the occasion to do so. They tend to be fairly informal. You are under oath, but the person who is making this decision is not going to hold you. The administrative law judge is an employee of the California Department of Social Services. They are independent. They have not been involved in the decision that's been made. And they are not going to hold you to the ordinary rules of evidence. You have the right to present your case. You have the right to testify and to submit relevant documents or evidence to support your case. Beneficiaries can and often do represent themselves. It is a process that makes that possible. They can also have what's called an authorized representative, or AR, and there is no rule whatsoever that the AR needs to be a lawyer. That all or any of you can be an AR for a client, a family member, a friend. The issue, the restrictions are very minimal on who can be an AR, and mostly around not presenting a conflict of interest or not being disqualified in some way. You are being an AR means that you speak on the person's behalf. You can attend the hearing on the person's behalf, but you don't have to. Again, there's a, you can get documents about the case. You can create an account on what's called I think it's called the Appeals Case Management System, ACMS are the initials. And as your AR, you can track what's been going on with the case, find out who the person from the county side is who's been appointed, and communicate with them as well as with the state more efficiently. It's a very good way to, if you are willing to take on the case in that way for one of your clients, if you're willing to take the case from start to finish, it's a very good way to make sure that you don't miss anything. The documents should certainly not by default, and I think not at all. I mean, I think this is not should not be mailed only to the AR. It should be such that the AR and the participant both get copies of all documents about the case, and that is indeed usually what I have seen. The county or the managed care plan also has the opportunity to attend the hearing and to present their side of the story. And they usually present what's called a statement of the case or a statement of position, where they lay out the law they're relying on to make their choice and why they made it. And so do you. You then have 30 days after the state fair hearing decision is released to ask for what's called a rehearing if you think the state fair hearing decision is wrong. After that point, after the rehearing, generally the remedies get much more difficult to achieve. But these first two steps are pretty easy to ask for, and often incredibly helpful. The number of problems that we've resolved not even by going all the way through a state fair hearing, but simply by requesting a state fair hearing, thereby getting somebody more senior at the county to take a look at it, or having the administrative law judge send a request for information that the county has realized that they can't answer. All of these things can cause a resolution of the problems that have really been snarled up for a long time. And we do recommend it as an avenue anytime that you see an action that you disagree with. Next slide, please. So Riley, did I get that right? Riley gave a rundown of thinking of a lot of what I wanted to say about this right at the start of the presentation. I'm going to reiterate, but hopefully not fully repeat. Next slide. The public health emergency has ended, and we are now in what we call the unwinding period, meaning that Medi-Cal terminations and rejections of services are once again going ahead. And as you are seeing, I am sure this is causing a bit of a flood of Medi-Cal terminations, a bit of a flood of confusion, of distress, and it is incredibly important that renewals, now that renewals are going ahead, that we are all ready to help process and navigate the process for people who are looking at Medi-Cal renewals for the first time. As a reminder, a renewal is when you are on Medi-Cal, you are asked every single year to update your income information and to update your household size, your address, all of these things. And for the last 3 years, when people have notified the county of changes in their income or their address or their household size, sometimes that's been updated with the county. Fairly often it hasn't. Fairly often the county just has not tracked any of that information because they weren't terminating any of these cases anyway. And it was easier to just let that slide. There was no easy way to continue to hold that information, so they just didn't. That means that a lot of people are now up for renewal, and the information that's in the system about their income, household size, or address is completely wrong. And they are now getting these packets, maybe which they've never seen before, which they have no idea how to navigate or understand, maybe in the wrong language, and very often to the wrong address, saying, hey, we heard that you had Medi-Cal. Here's all of the information we have about you. And they're completely flabbergasted because it looks completely wrong. Or they don't get it at all, and then they just get the notice saying, or sometimes just an email saying from Benefits Cal saying, oh, you're being terminated. And then they call us and they say, excuse me, I'm so sorry. What's going on? It is absolutely vital that everybody complete these renewals, even if they do not think they are eligible for Medi-Cal any longer. I can't stress enough how important it is to complete the packet and turn it in anyway. This is true for multiple reasons. One, you don't want this situation to be that you are being terminated for a procedural reason when you didn't turn the packet in, when it turns out that you're eligible for Medi-Cal anyway. You think, well, I'm working, so there's no way I'd be eligible, but actually you qualify for working disabled Medi-Cal. Or you think, well, I went back to work. Of course, my spouse is at home with terminal cancer and I'm providing full-time care, but I'm his IHSS provider now. And I make tons of money that way. I mean, not tons of money, but I make over the Medi-Cal cutoff that way, and I don't receive. And I know we're not eligible for Medi-Cal. I know that's not true. No, you probably are. You may fall into one of these exceptions. Or on the flip side, you think, well, there's no way I'll lose my Medi-Cal. My income in the system has not changed. I am still the same person in all regards as I was in 2020. And you may just simply not realize that the automatic process, which was supposed to go forward, did not go forward. And instead of having your Medi-Cal automatically renewed, which it was supposed to, some glitch occurred in the system, and actually you've been kicked off, and now you haven't had Medi-Cal. And then finally, it is important to complete a Medi-Cal renewal packet because we've run into a glitch, which is that if you do not submit your Medi-Cal renewal packet, sometimes the case doesn't get released correctly so that it can go on to Covered California. So if you have income that is over the Medi-Cal cutoff, maybe you've been receiving Covered California even by mistake. You've been receiving both at once, although you weren't supposed to. And then you don't return your Medi-Cal renewal packet when it gets issued out. And the county puts you on some kind of processing hold, and suddenly your Covered California bills are coming in and they're through the roof, and you say, why? And then you call us. It's because your Medi-Cal renewal packet was not submitted. Whether or not that is required, it certainly speeds up the process a whole lot. So we do recommend that everybody complete and turn in their Medi-Cal renewal packet, no matter what. And if they haven't gotten it, we recommend very strongly that they contact the county. Next slide. When somebody is over income, if they fall into the limits if they fall under certain income limits, they should automatically be referred to Covered California to be enrolled into the cheapest silver plan available. This is not always working the way that it's supposed to. People are following through the cracks. What is incredibly important is to know that there are state fair hearing rights on Medi-Cal enrollment, on Medi-Cal disenrollment, on Covered California enrollment, on Covered California disenrollment, and on the amount of advanced premium tax credits assessed to somebody, right? Those are all hearable rights. And we do recommend filing a state fair hearing immediately if somebody is terminated or discontinued in a way that you think is wrong. Absolutely, if you have a backdoor to the county, call the county, or if you have a good relationship with your worker, call your worker. But if they don't get back to you, don't wait. File a hearing. Get this heard. The scale of the problem is pretty large. 200,000 people were sent terminations in the month of June for procedural reasons alone, per the state's most recent database. So maybe all 200,000 of those people had health insurance and weren't worried about it, but I would be surprised to find out that information. So let's make sure that we I'll work together to protect as many of these people as possible. Next slide. Oh, and please enroll in the Project Home Base webinar. I may also do that. So Medi-Cal for those experiencing homelessness. Next slide. We just wanted to focus on some special issues that will come up with your particular clientele. Medi-Cal, so for state benefits, which are administered by the county, like Medi-Cal, also like food stamps, also like CalWORKs, people experiencing homelessness are free to move between counties and often do, as we all know. But they must designate one county as their permanent residence. And that matters because Medi-Cal, for the vast majority of recipients, and more every year, is provided through managed care plans. And managed care plans are county bound. You receive Santa Clara Family Health Plan, you receive Alameda Alliance, you receive Partnership Health Plan of Marin, right? You receive San Francisco Health Plan. They're not always named that, you know, maybe it's Anthem Health Plan, you know, Anthem Blue Cross of Contra Costa County, but it's true. It is true that the benefits that are offered are generally county bound. That means that most people who experience homelessness must go to that county to get health care. But there are ways around this. Call us if you or a client falls into this category. You are, you know, where you are, or your client or your family member or your loved one is itinerant, is moving between Santa Clara. Maybe they live, you know, they're staying on the border of Fremont and Berryessa, and they're crossing back and forth all the time. And they have providers on either side of the county border, and they're, you know, they're one set of the providers is saying, well, now that you're on Medi-Cal, I can't take you. You're outside our plan. Call us. We'll talk. There are options. There's continuity of care protections. You've been seeing this provider. You can continue to see that provider at least for some time. There are rules about when out-of-network coverage must be provided, depending on the circumstances, and there may be options. Proving residency is obviously very difficult for homeless people, and we've talked about, Riley suggested earlier that you can provide social service agencies addresses as addresses. That's absolutely true. You may need to add a letter saying, you know, I'm a homeless services provider and I verify that this person is receiving services from me in this county. Bay Legal has written those letters, I believe, in the past. You know, homeless service agency is construed pretty broadly, which is great. So that can work to prove residency if the person absolutely has no ability to do so. And counties are actually required to accept telephonic attestations and affidavits for most aspects of eligibility. So somebody who has zero income, for example, well, you can't provide proof of zero income. There's not a lot that you can do to demonstrate that, right? Most people who are homeless are not filing taxes. You know, there isn't a lot that you can demonstrate it. No worries. Usually that person can call in and swear under penalty of perjury over the phone that they receive no income, that they are homeless, whatever the circumstance might be. The exception is citizenship and immigration status. Although that may not be relevant for all Medi-Cal recipients, right now it still is for you know, some category, and where that is required to be proven, the county is required, I believe, by federal law, but anyway, they're still required to get written documentation for those things. Next slide. So getting notices, as Angelica stressed, not missing these notices can be really important, and they're mostly sent by mail. General delivery can work. It doesn't work great, but it does work. PO boxes are really work. PO boxes are definitely the gold standard solution. Things can be mailed to a family friend or to a service provider. They can be picked up at the county office. Again, I've seen mixed results on that, but it can work okay. Benefitscal.com is the website that is meant to replace postal services for most benefits recipients in California. It is rolling out county by county, and some counties are still on mybenefitscalwin.com, but Santa Clara County is a benefitscal.com county. It seems to work okay right now. It is still sort of, it is still fairly new. But having a benefitscal.com account is a good way to make sure that you can track benefits that are coming in and notices that you're receiving. And it's a good way to report your information without needing to have a fixed address. As I mentioned, state fair hearings are no longer mostly in person, they're mostly by telephone. And if somebody does not have a phone or a stable ability to make a hearing by phone, you can request in person. Hearing requests can be made online or by email or again by phone. There are a lot of modalities there, and we've found that the DHCS office is very helpful, and the CDSS State Fair Hearings Office is actually very helpful and very flexible in terms of trying to help people find out what their state fair hearing rights are and access those. Might be a long hold time, but generally speaking, you'll speak to somebody who can assist you. Disabled applicants and beneficiaries can request accommodations for more time to provide additional documents or to fill out or complete a renewal. This is obviously very important right now. Any needed information can be provided verbally. Telephonic signatures can be given on affidavits. And the information requested in the packet cannot be restricted to one single modality. It can be supplied by mail, by fax, by email, in person, or over the phone. This is incredibly important. This is a legal right that beneficiaries have. I should stress right now, all of the counties in which we practice are crazily overloaded. They are heavily we are getting a lot of reports of people who are like, I was on hold for an hour and I couldn't get through to anyone, or I went in person to X office and they told me they couldn't do X, Y, and Z because the system was down, or I tried to log into benefitscal.com, system was crashed. This is very common at the moment because of the overload of the system caused by the unwinding. I don't have any great advice on this except for to say that if this causes a termination, a discontinuation, or a reduction in services, that I strongly recommend filing a state fair hearing. And also, be patient and believe your beneficiaries when they tell you that they're having a really hard time accessing these services. It is very difficult. Next slide. Real world hypotheticals. Okay, we're going to review a lot of the material that we've done over the last couple of weeks, and we're going to be referring to some concrete numbers. I'm just going to give you a quick refresher of some of those. The cutoff for what we call Magi and Medi-Cal, as well as non-sheriff cost non-Magi Medi-Cal, is 138% of the federal poverty line, which for one person is this year is about 1677, depending on how you calculate it, 1677 per month. The asset limit for one person this year is $130,000. And remember, that's going away January of next year, and that's for Medi-Cal. Covered California starts at 138% of federal poverty level and above, and goes up to, with subsidies, goes up to about 600% of the federal poverty level. Employment and non-employment income is calculated differently, with employment income counted at 50% for people who are older than 65 or who are totally and permanently disabled only, and that's under the non-Magi Medi-Cal rule. So that's just a quick refresher of some stuff we've talked about. There are other rules that come into play, but I just wanted to flag them before we move on to the next question. Let's go on to that now. So let's talk about Cy. Cy logs on to coveredca.com. He is 45 years old. He is unmarried. He is not disabled. He has 138,000 in checkings and savings combined. He makes about $1,200 per month in employment income, and he has no other income. What health plan is he eligible for? I think there is a poll question for this. There we go. So take your guess as to what health plans I might be eligible for, and I'll give you guys a minute, and then we'll come back. And once you have put in your answer, let me know as you start thinking about the question at the bottom of the page. What would change if his income was from SSDI, except for instead of employment? All right, let's, oh, great. One more moment, I'm gonna give it 15 more seconds. All right, next slide. So for the two people who answered Magi Medi-Cal, congratulations, you have aced our course. You can log off right now. No, please don't. But that is correct. As a refresher, Magi Medi-Cal stands for Modified Adjusted Gross Income Medi-Cal. It's the way that you calculate eligibility for Medi-Cal for people under 65 who are not disabled, and it has no asset tests. That was a trick, and it has and employment income is counted the same as any other kind of income. It is taxable income versus non-taxable income, more or less, you know, dollar for dollar, with a few funky exceptions. Cy is under 65. He is eligible for his income is calculated on the Magi test. And his income is below 138% of the federal poverty level, which means he's eligible for Medi-Cal and not covered California with APTCs. So everybody who answered Magi Medi-Cal, you did a great job. Those of you who answered non-Magi Medi-Cal, that would be if Cy was indeed disabled. If Cy was receiving SSDI, for example, he might be eligible for non-Magi Medi-Cal. In fact, but that's where the asset limit comes in. He would not be eligible for aged and disabled Medi-Cal, which is a non-Magi program, because his assets are currently too high. He has $138,000 in the bank. However, he may be eligible for Medicare, depending on how long he's been on SSDI, because as you might remember from last week, once you're eligible for SSDI for 2 years, you may be able to access Medicare. He's not eligible for covered California with APTCs in this instance because he is eligible for Magi Medi-Cal. Okay, next slide. Mark lives with his unmarried partner, Min, and their 2 children, Missy, who is 12, and Molly, age 22. They want to apply for covered California benefits. So who would be in this household? Let's get the next poll up. Just give your best shot. We're learning by doing. Let's go to the next slide. A lot of correct answers here, actually. It does depend on how they file, but some of the possible answers here, based on what assumptions you made about this household, and I mean that in a totally normal way in this instance. Mark might be in his own covered California household alone. Mark might only be able to claim his minor child. Mark might be able to claim both his kids. It does depend on how they file. Because Mark and Min are not married, they are going to apply for covered California separately. And their children are going to be included in the household of the parent who claims as dependent for their tax purposes. But if Molly isn't on either of her parents' households, which she might not be, she might have her own health insurance. Maybe Molly has a job. Maybe Molly gets her health care through her university. Maybe Molly's on Medicare. Molly may not be eligible for covered California. So Molly could be totally separate from this household. So it really just depends on how they do their taxes. Next slide. Sally is 59. She gets SSDI. Her income's $1,500 a month. She's had Medicare, and because her income's $1,500 a month, she's been getting aged, blind, and disabled Medi-Cal. Remember, her income is below $1,677. She then becomes eligible for a pension income of $475 per month. And the county has informed her that her Medi-Cal has now been assessed a share of cost, which is $1,190 a month. Well, she can't afford her medical care with a share of cost of $1,190 a month. That deductible is too high for her. What can Sally do? This is not a poll, and I'm going to move on to the next slide for a minute. I'm just going to let you guys think for a moment, though. Okay, next slide. So first of all, you want to make sure that Sally knows her Medicare should not be impacted. Sally is not going to lose her Medicare because Sally has a Medi-Cal share of cost. Her Medicare will continue to stay in place. They're two separate, different programs. But with share of cost Medi-Cal, she will be paying her own Part B premium, which is $164.90 this year. And Medicare Part B on its own, if she doesn't get a Medicare Advantage plan or something like that, her out-of-pocket expenses could still be pretty high. So this can still affect Sally's life. So Sally, remember that your income for non-Magi Medi-Cal can be deducted. It's calculated involving deductions from your healthcare premiums, what premiums you pay. So Sally's Part B premium will automatically be deducted. That $164.90 will be subtracted out. But if Sally enrolls in a Medicare Advantage plan, or if Sally buys a Medigap plan or a dental plan or something similar, those premiums can be deducted from her income and reduce her income down below that 1677 countable cap, such that she's able to stay on free, no share of cost Medi-Cal. Or Sally might be eligible for the 250 Working Disabled program. This question is just in here to remind you of the existence of the 250% Working Disabled program. For people who make up to 250% of the federal poverty line and have a disability-based income like SSDI, or had a disability-based income of like SSDI and then reached retirement age, those people, if they work even an hour a month for even $1, they may be eligible for this program. They just need to genuinely receive money for any amount of work. And if so, they may qualify for the program, and then they affirmatively tell the county, hey, I'm working, I'm disabled, I'd like to qualify, and then they're back on free full scope Medi-Cal again. It's pretty great. It is very little known. That's why we're hammering it so hard. Next slide. Example 4. So Joseph is 67 and he's single, and his Social Security retirement benefit is 2275. He has Medicare, and he's currently paying $148.50 a month in Part B and $60 in vision. And he's got $1,800 in his checking account. Does he get free full scope Medi-Cal? This is also a yes, thank you. This is a poll. So just as a reminder, the cutoff for 138% federal poverty line is 1,677 per month for one person for 2023. Next slide. Joseph does not. Thank you to those of you who said no. Joseph has a share of cost. Joseph does qualify for full scope Medi-Cal. He's eligible to get his, to get all the Medi-Cal benefits anyone else is entitled to, but he will have a monthly deductible, and that monthly deductible will be very high. We've got the calculations up on the slide. In the interest of time, I'm going to skip ahead, but take a look at this when you look at reviews your slides after the program. Next slide. That's it for us today. Those real world problems can be very finicky. I do recommend taking the time to look them over after our meeting today. But as I said last week, we include them just to give you a taste of the complexity of the programs and the difficulty of the math that gets done on the back end. We always recommend that everybody apply for all the programs they're eligible for. It can't hurt. And as long as they're reporting their income accurately and fully, and hopefully we are here to help you navigate those problems. Let's see if there's any questions in the chat.
So there doesn't seem to be any questions in the chat that didn't get answered yet. So if folks want to take the opportunity to come off of mute and ask your questions that might be on your mind, or you can utilize the chat function as well, whichever one works for you.
Thank you.
Looks like we did get a question in the chat. What is the income level for 2024?
Thanks, Laura. Department of Healthcare Services in Covered California. So basically, the federal poverty level is set by the federal government every year, and we don't have 2024s yet. It'll be set towards the end of the year, I think. And then come January or come December, again, around the end of the year or the beginning of next year, Covered California puts out a calculation, and so does DHCS put out a calculation saying here's how we're doing the math on what 138% of the federal poverty level is. But you can do your own math on that once you have the new federal poverty level figures from the federal government, because it is just multiplication. The Health Consumer Alliance puts out a chart every year as well. If you search Health Consumer Alliance and then federal poverty level chart or income level chart, you'll see, and then put in the year, we update that every single year. As soon as we have those facts and figures, we put it up, and we do recommend referring to that when it's available.